Good afternoon, Mr. Roush. I'm so happy you could join us today.
Well, thank you, Dr. Catic. I'm pleased to be here. Good to see you.
Good to see you. For the purposes of this, I'm going to introduce you to our colleagues here at the Geriatric Society of America. Is that okay?
Sure.
Excellent. So Mr. Roush is a 78-year-old gentleman who's well known to our geriatrics clinic here at the VA with a past medical history significant for hypertension, hyperlipidemia, and obstructive sleep apnea. In the past, he had declined to use CPAP for his sleep apnea because he found the machine uncomfortable and had not felt that he had any noticeable symptoms due to his sleep apnea. Now, as you probably recall, Mr. Roush, we had implemented a process known as age-friendly care in our clinic starting in January 2020. And as part of this, we had the opportunity to discuss what matters with you, including identifying your primary value, setting goals related to that, and then modifying your healthcare based on this conversation. I was wondering, had you previously been asked about what matters to you as an individual during any medical encounters, or was this a new experience for you?
Well, it was totally new. And first of all, I like it. Given my age, I've had lots of encounters with healthcare professionals, whether it's medical doctor or PAs or nurses or dentists. No one's ever asked me, what matters most to me. And I thought that was kind of new. It kind of sharpened me to focus my attention maybe a little bit on what I need to do better.
Excellent, wonderful. Well, I'm glad we had the opportunity to have that conversation. And it sounds like it was a little bit surprising because it was different from what you had experienced before. But overall, would you say, did you feel comfortable discussing your values and goals with us there in clinic?
Oh yeah, I did, and up until then, it was all about what's your blood pressure and what's your sugar level, and and this, that, and the other, and it was kind of dry and clinical, if you will. So yeah, this got down to more of an interpersonal relationship with another person who's interested and concerned about me.
Great. And I'm gonna test your memory here a little. I'm gonna ask you if you recall what you identified as your primary value. And you may remember that in the patient priorities framework, which is what we use in our clinic to discuss what matters most, we talk about the 4 core values, and those are connecting, enjoying life, functioning, and managing health.
Yeah, I do remember that, and again, I liked it. Kind of establishes a little bit of a framework in which to be a little more reflective, I guess. And what do I want to do? And I think I told you, and if I didn't, I should have. That what matters most to me is being with my wife. We've been married 55 years now, and she's 75 years old and has some rheumatoid arthritis and some other issues. But we like to walk. We used to walk a lot. We got to the point where we just didn't do that. And then might as well go ahead and throw in the COVID aspect. We just kind of, like everybody else in America, kind of stuck at home. So, but yeah, she's my number one priority, and our kids and grandkids, of course, but mainly her.
Excellent. So I remember that as well. And you really you lit up when you spoke about her. And after you identified that your relationship with your wife was your primary value, you and I had a conversation and worked together to set a goal related to that value. And we talked about it being something that should be really realistic, given your current health and given the current situation with COVID, as you mentioned, as well as being specific so we could follow up and make sure you were achieving that goal. And we also talked about if, God forbid, you had a significant change in your health or other circumstances in the future, we could always come back and revise that goal as needed.
Right. And I do remember that. I think I told you, just get tired, in the mornings, and even though I'm sleeping all night, seemingly, I just don't have the energy levels that I used to have. And that was probably one of the reasons we didn't walk as much as we used to do together, which we thoroughly enjoyed. So I want to get back to that if I can.
Okay. And can you tell us and the audience here a little bit more about our discussion around how we were going to modify your health care, or what trade-offs you were willing or perhaps not as willing to make in order to work towards your goal of taking daily walks with your wife?
Well, yeah, I do remember. I'm kind of hard-headed and stubborn at times. I do remember you bringing up the CPAP, and I tried it once, didn't like it. Know a lot of friends my age that have it. They don't like it either.
Mm-hmm.
At least the big old-fashioned cumbersome kind. So yeah, I didn't want to do it, and were trying to talk me into it, and so we went from there.
Right. I remember you were really reluctant to try the CPAP. You tried that in the past and found it uncomfortable. And so we were trying to find other ways that you might feel more rested and able to walk with your wife. And if I'm recalling correctly, first we talked about cutting out caffeinated coffee in the afternoon, switching over to decaf.
Right.
But after a couple weeks, when we followed up on the phone, you told me that really hadn't made much of a difference.
That's true.
And then we actually decided to try some melatonin.
Yeah, and
And
that worked.
mhm,
Melatonin worked. Never had taken it before. A lot of people have. I think my mother used to take it
mhm.
long ago, but I hate decaf coffee. Well, I drink coffee unless it's going to give you a kick.
Yeah.
But yeah, this switching to decaf in the afternoon didn't seem to work. But the melatonin did. But I still, I guess needed some extra help. So I was willing to work with you on it.
Okay. So I know the melatonin seemed to help you get to sleep, but from what I recall, you were still pretty tired when you were getting up in the morning. You were still having a hard time finding that energy to take a daily walk with your wife. Am I recalling that
Yeah,
correctly?
no, that's true, and I was disappointed in that. I thought maybe if I
Hmm.
slept better all night long, I'd have the energy to get up and walk in the morning. Didn't pan out.
Okay. And then tell me about our conversation, or what you recall of it the next time you came in, and once again we had that discussion about CPAP.
Well, I agreed to try it
Mm-hmm. Mm-hmm.
reluctantly, but so anyhow, we went from there. So I hope it's going to continue to be of help. Um, so I just you told me to think of it as an experiment.
Right.
I like that idea. I know a little bit about experiments, at least reading about them and things like that. So yeah, I kind of figure, well, it's worth a try.
Mm-hmm.
And, after I try it, I feel better. Then obviously it worked, uh, and it did.
Yeah. And it did.
So thank
So
you.
you're welcome, and thank you for working with us on the experiment. But since you've been using it, you've been feeling more rested in the morning, and you're able to get out and take a regular walk with your wife. Is that correct?
We have been, of course, you know, looking forward to more cooler weather this fall, where we can enjoy the walks more than you
Yeah.
did earlier in the year. But it does seem to, when I wake up, I feel rested,
Mm-hmm.
and then have a little spark of energy to the point where we can go walk in the neighborhood. So that's good. Feel good.
Wonderful. And if you were talking to another patient, another older adult out there, what would you tell them if their medical provider was wanting to talk to them about matters most, or perhaps they wanted to bring up to their provider what was most important to them, what their values were?
Well, I would tell them it worked for me.
Mm-hmm.
It was the notion intrigued me, and I liked the interpersonal relationship of it. Again, it helped me focus on what I need to do in order to have a better life, quality of life, and it worked. Um, if all you've got in front of you is something on my chart that shows what your cholesterol level is and what your A1C is and stuff like that, sometimes you got to go to medical dictionary and look all that stuff up.
Mm-hmm.
This way, you kind of just are talking to somebody that probably knows what they're talking about and agree to try it. So yeah, I'd recommend it highly. I like this. What matters most.
Wonderful. And I think this is a great example of how focusing on your value of your relationship with your wife and setting the goal of taking a walk, that made trying the CPAP worthwhile to try that again. Where perhaps in the past, treating sleep apnea, which you didn't really feel any symptoms from, that was a heavy lift to ask.
Yeah, right. When you have sleep apnea, you're snoring, you just don't know it until you wake up. You can't breathe. But yeah, I'm glad it worked out. I appreciate you're taking this approach with me, and yeah, I highly recommend it.
Excellent. Well, I'm glad it worked out as well, and thank you for sharing your story with us today. We really appreciate it.
You're welcome, and thank you for asking.
Okay, take care.
Same to you, Dr.
Bye-bye.